Many have called this a battle, which means for this paramedic, this isn't just an apron, it's a shield.
For the apron, thin PVC apron, obviously it doesn't cover full uniform. We actually normally use these for cleaning the ambulances after a messy job.
Along with gloves and a surgical face mask, this is what the government says is safe enough for day-to-day interactions with a confirmed or suspected COVID-19 case. But this paramedic wanted to speak out. This kit, he says, is putting people at risk.
Initially, we struggled with supplies of PPE. We're getting lots of supplies of PPE, but now it seems like a lot of it is substandard and inappropriate. A lot of us feel that we end up wearing a uniform for a 12-hour shift, that if you've entered someone's house that has possibly got COVID-19, that uniform's not being covered properly. You don't feel you want to leave one patient to walk into a care home and then plant that virus in a care home for it to spread around elderly, high-risk patients. And unfortunately, that's probably going to happen.
What this paramedic wants is more robust protection like this. But it's currently only recommended when in high-risk areas or doing more invasive procedures. It can leave paramedics heading into the unknown feeling exposed.
We have been finding that a lot of PPE has been distributed to a wider part of the healthcare system. And for ambulance services, they do seem to be struggling to try and get that supply of personal protective equipment. It is incredibly challenging, and I think what we need to do is we just need to make sure that the paramedic, the frontline healthcare professional, is not forgotten.
Public Health England told us their protective equipment guidelines match that of the World Health Organization, but that they would soon be updating them. But how, they didn't say.
I'm sure it will come through eventually, but that's the unfortunate thing. We're already in the middle of this. It should have been there in the first place. We shouldn't be having to muddle our way through it, feeling unprotected. It does make you feel vulnerable.
And right now, these are key workers we can't afford to lose. Katerina Vitozzi, Sky News.